Health Talk. Join us as we talk about your health. Welcome to Health Talk. I'm your host, Kemisha Tinga, and here with me I have Melika Thomas, Kedia Summers, and also Sunny Dula. Today we will be discussing respiratory syncytial virus. I know you may wondering what the definition of this virus is and also the symptoms. So Kedia, can you tell us what is the definition of respiratory syncytial virus and also the symptoms that one may experience when they have this virus?
Hi, my name is Kadia Samuels. Respiratory syncytial virus, also known as RSV, causes infection of the lungs in young children and infants. It can cause pneumonia and also bronchiolitis and is transmitted through contact with infected secretions such as mucus from sneezing and saliva. RSV is the most contagious within the first 2 to 4 days after the child has become ill. The infection can last between 2 to 8 days. However, the symptoms can remain up to 3 weeks. According to Trends and Surveillance of RSV in the US 2020, each year in the US, RSV consists of 2.1 million outpatient visits among children younger than 5 years old and 58,000 hospitalizations among children younger than 5 years old. Some of the symptoms of RSV include runny nose, wheezing, fever, irritability, sluggish movement, decreased appetite, sneezing, coughing, difficulty breathing, lethargy, breathing faster than normal, decreased activity, and apnea. Thank you.
Thank you for that information, Kadia. So, Zani, what are the treatments that one may receive when they're in the hospital for respiratory syncytial virus?
I'm Janae Dulam and I'll be presenting on the treatment and management of RSV. RSV tends to go away in a short period of time without any treatment at all. In severe cases, medical treatment must be administered. This includes a mechanical ventilator. This is used to inflate the infant's lung until the virus goes away. Secondly, we have oxygen administration. Thirdly, we have intravenous fluid or fluid replacement. Pharmacological treatment can be administered in severe cases of RSV. These include bronchodilators with beta agonists and antivirals such as ribavirin.
Thank you, Zani. So, Melika, hear what? I'm going to give you a scenario and I want to hear how you rationalize as to how you would treat and give care for this patient. So, Melika, here's the scenario. Bridget, age 11 weeks, admitted with respiratory distress but no fever. The bronchi and bronchioles are plugged with thick, viscid mucus. The infant has had poor feeding for 2 days. Prior to this, the infant was otherwise healthy. Today, the infant presents with low saturation, with a consistent cough and a shallow respiration of 80 breaths per minute. What would you do?
Okay, so a child comes in presented with all these symptoms. The first thing you're going to be thinking about is oxygen as your priority, and so you're going to have ineffective airway clearance related to the infectious process, as evidenced by bronchi and bronchioles are plugged with thick, viscid mucus, low saturation, a consistent cough, and shallow respirations at 80 breaths per minute. The next thing you're going to be thinking about is ineffective breathing pattern related to infectious process, as evidenced by the low saturation, a consistent cough, shallow respirations at 80 breaths per minute, and the bronchioles are plugged with thick viscid mucus. According to this scenario, it says the infant had poor feedings for 2 days. So you're going to be thinking right away nutrition. And so you're going to have impaired nutrition, less than body requirements related to difficulty feeding, as evidenced by infant has had poor feeding for 2 days. Next, you're going to be thinking about risk for fluid volume imbalance as evidenced by poor feeding for 2 days and insensible loss via tachypnea. You're going to also have risk for aspiration as evidenced by bronchi and bronchioles are plugged with thick viscid mucus, respiratory distress, and the fact that the infant is aged 11 weeks. So safety is also a priority. Okay, so our care plan is an ineffective airway clearance. And so for the assessment data, subjective data, prior to this, the infant was otherwise healthy, age 11 weeks. Objective data, bronchi and bronchioles are plugged with thick viscid mucus, a low saturation rate, a consistent cough, and shallow respirations at 80 breaths per minute. Nursing diagnosis, ineffective airway clearance related to infectious process as evidenced by bronchi and bronchioles are plugged with thicker viscid mucus, low saturation, a consistent cough, and shallow respirations at 80 breaths per minute. Patient outcome. Within 2 hours of nursing and collaborative care, patients will obtain and maintain a patent airway free from secretions or obstructions. Respiratory rate will be within parameters for age. Nursing interventions and rationales. 1. The nurse will assess for a patent airway, and the rationale is maintaining a patent airway is always priority. 2. The nurse will position the patient with the airway open, and she can do this by sniffing position if supine or by a folded towel as a shoulder roll. And the rationale is to maintain a patent airway also. 3. The nurse will administer oxygen as ordered, and the rationale is to improve oxygenation. 4. The nurse will suction the patient as necessary using nasal bulb suction, and the rationale is to remove excess mucus and maintain a clear and patent airway. 5. The nurse will perform postural drainage and chest percussion as ordered, and the rationale is to promote mucus clearance by mobilizing secretions. 6. The nurse will ensure adequate fluid intake, intravenous or oral, and the rationale is to help liquefy secretions for ease in clearance. 7. The nurse will maintain NPO status as ordered, and the rationale is to avoid the risk of aspiration. 8. The nurse will administer antivirals such as ribavirin as ordered, and the rationale is to lessen symptoms of the infectious process and speed up recovery. Evaluation of care. Goal met. Within 2 hours of nursing and collaborative care, the infant maintained patent airway, free from secretions or obstructions, and the respiratory rate was within parameters for age.
Thank you, Melika. And now we'll have a poem by Sunny.
I have a poem. RSV is a very common respiratory virus. Yes, RSV can be very dangerous and contagious. It affects the lungs and its bronchiole, infecting most children by 2 years old. Just like flu, RSV is a seasonal illness. Symptoms ranges from decreased appetite, decreased activity, shallow breathing, and fussiness. RSV can lead to other serious illnesses such as pneumonia or bronchiolitis. In most severe cases, a person may require additional oxygen or intubation. This can even go as far as using mechanical ventilation.
With that said, this is the end of our health talk. Thank you for listening, and I hope you have learned something. But remember, your health is your responsibility.